Miriam. I'm Sarah. I'm a student nurse. Can I have SBAR on the patient?
Sure. This is Mrs. Marta Yarn. She's an 80-year-old female admitted for a stage 3 sacral ulcer. She's had it for about 3 months. She's a full code. Her doctor is Dr. Jolly. She's 175 pounds. She's 5'5". She lives alone in her senior apartment. She's widowed. She's got 2 kids, but they don't live around here. She's mostly alone. She's been hospitalized frequently. Last hospitalization was 6 months ago for pneumonia, and previous before that for dehydration. She's on a regular diet. For her skin, she's got the sacral ulcer stage 3. It's 4 centimeters by 4 centimeters and 1 centimeter deep. And again, she's had that for about 3 months. The rest of her skin, she complains of itchy, dry, scaly skin, but it's all intact. She's slightly hard of hearing, denies any nasal problems or sore throat. She denies any cardiac problems, chest pain, palpitations. She's got no respiratory problems with this admission, and she's a non-smoker, no respiratory history. She's had a decreased appetite recently within the last 3 months, but her stools and her urine have been normal, and she doesn't complain of any nausea, vomiting, or diarrhea. She does have some stress incontinence at times, but other than that, her urination is normal. She's a little weak, slow moving. She uses a walker to get around. She's been having some back pain for the last 3 months, but it's relieved with some Tylenol. She's ANO times 3, completely alert oriented, does complain of some general weakness. Her blood cultures were positive for E. coli, probably due to the sacral ulcer. Bilirubin, BUN, was slightly elevated at 22. The bilirubin was normal. The creatinine was normal. So today, we're going to consult dietary for her decreased appetite, give her a little education on that, and also administer the gentamicin that was ordered by the provider for her. Her vital signs were good too. Let me tell you those.
Okay.
Yeah, the last set was 144/90, a little bit high. She's 92%. Respirations were 24 and pulse was 88.
Okay.
So, do you have any questions?
Yes. Why specifically is this client receiving this medication?
It's to fight the infections. Like I said, her blood cultures were positive for E. coli, so that's what the doctor ordered.
What action does the medication have on the body?
Well, it inhibits protein synthesis for gram-negative bacteria like E. coli and
Okay.
the 30S ribosome, which in turn has a bactericidal effect, so it's going to kill off the bacteria. And it's excreted 90% through the kidneys, and it also affects the liver. So we're going to check the kidney and liver functions prior to administration.
Okay. When should you question administering this medication? And does it have a therapeutic serum level?
You should question if they have a hypersensitivity to the drug or other drugs in the aminoglycoside category. If they have renal impairment, there should be dose adjustments for the renal impairment, and if the dose adjustments were not taken into account, probably notify the provider.
Okay.
If they have hearing impairment, or if they have a neuromuscular disorder like myasthenia gravis.
All right.
And there is a therapeutic serum level. The peaks should not be higher than 10 micrograms per ml, and the troughs should not be lower than 2 micrograms per ml for effectiveness.
Okay. Which vital signs must be monitored?
All the vital signs are going to be monitored, but especially the temperature, to make sure that her infection doesn't get worse, or like it's also a sign and symptom of a superinfection for the temperature to become elevated.
Which physiological parameters should be monitored when the medication is being administered?
You want to check the 8th cranial nerve, the vestibulocochlear, for hearing loss or vertigo, dizziness, nausea, vomiting, because that is one of the adverse effects of gentamicin. Also, monitor closely the I's and O's and any for any water retention daily weights, because it affects the kidneys, and we want to assess the kidney functions. Want to assess the labs, the BUN creatinine,
Okay.
and the AST/ALT.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, at home, you want to let them know, because gentamicin can be administered PO.
Okay.
At home, you want to let them know that they need to take the full course of antibiotic to prevent superinfections. In the hospital, you want to teach them to report signs and symptoms of anaphylaxis, rash, hives, also report vertigo and hearing loss, and teach them to drink lots of liquids to help their kidneys.
Okay, so in the hospital and home setting, it's similar, the
Right.
interventions?
Right, yeah. Tell them to drink lots of water at home as well, and go to the hospital immediately if they're having an anaphylactic reaction.
Okay. What are the side effects and potential adverse reactions?
The adverse reactions would be renal failure and stand by. I'm sorry, can you repeat the question?
The adverse reactions and side effects. I know you were talking about they should come in if they have anaphylaxis. Are there any other things we should be concerned about?
Oh, the hearing loss that I've been talking about. Anything that I've said so far, the hearing loss, the lab values.
Okay. How will you know the medication's effective?
If signs and symptoms of the infection decrease.
Okay, those are all the questions I have for now.
All right. Well, let's go and give Miss Yarn her medication. So before we go in the room, I already checked her lab values. And like I said, the BUN was 22, it was slightly elevated, but it's not elevated significantly. The bilirubin was normal, and the AST and ALT were normal, and the creatinine was normal. So we're good there. She
Okay.
hasn't had the medication yet, so we're not checking the peak and trough.
Okay.
We're gonna check the dose and make sure that we have the right medication here. It says gentamicin, 80 milligrams per 100 mLs, which is what we have here.
Okay.
And also I'm on Miss Yarn's chart, and I see the ordered by the physician, gentamicin, and also the sodium chloride, 0.9%, normal saline, and which we also have.
Okay.
All right. Let's go see Miss Yarn. Knock, knock.
Come in.
We're also gonna do hand hygiene. Have some.
Thank you.
Hello, Miss Yarn. How are you?
Hello, how are you?
I'm good. I'm here to administer your medication.
Outstanding.
How are you feeling?
Excellent.
Great. All right, Miss Yarn, I'm gonna have you identify yourself with your name and birth date.
My name is Marta Yarn. I'm 80 years old.
All right, and that checks out. That's 2 identifiers right there. All righty. Do you have any allergies to any medications?
No allergies.
All right. So I'm gonna scan your bracelet for the normal saline with potassium chloride 20 milliequivalents that the doctor ordered at 125 mLs per hour. And here is the sodium chloride, 0.9% with 20 milliequivalents. Checking the expiration date. Everything checks out.
Okay.
So we're gonna scan the patient. Let me see your bracelet, Miss Yarn. Oh, and that, of course. It takes a couple of scans. I'm sorry. Alrighty, so we have the right patient.
Okay.
We checked it against the MAR. Now we're gonna check the right medication, the sodium chloride first. And we have the right medication. It
Oh,
turns
yes,
green.
it turned green.
So, where's your IV site, ma'am? There it is. Okay. computer's a little difficult. All right, so let's set up the pump. We have some tubing here,
Okay.
and we're gonna keep everything sterile.
Mm-hmm.
So we're gonna take off the little blue thing. We're gonna make sure that our tubing is clamped off. Keep the spike sterile. Spike the medication. Oop. There. Keep that about half full.
Okay.
And now we're going to get the bubbles out and prime our tubing. That just knotted up on me. I think we need a new bag. Okay, well that happens sometimes.
Okay,
so we're gonna try again.
Okay, stand by. I'll stay here while you get a new bag of fluid
Okay,
from
yeah,
the
you
supply
stand
room.
there. Crap. Okay, so I'm getting a new. That's great. Seriously? Okay. All right, so I have a new bag of sodium
Oh,
chloride,
good.
and I've already spiked it, and so now we can prime the tubing.
Okay.
Oh, there we go. It's priming now.
Okay, yes. It
Okay.
definitely looks like it's priming.
All right, all the air is out.
Okay.
I'm hanging this bag lower than the other bag. I have two of these now.
Mm-hmm.
gonna
And that's
hang
to
that
make
low.
the piggyback go, or is there a
That's
different
correct.
reason? Okay.
That's so the piggyback will infuse before the fluids start to infuse.
Okay. I'm just gonna look close at what you're doing with the pump there.
Okay, all I'm doing is putting the tubing into the pump right now, and I'm just gonna hang this up here so it stays sterile.
Okay.
While I get another piece of the pump here that is not attached.
Okay, that makes sense.
Oh no, wait, we don't need two pieces of pump. What am I doing? Okay, so now we have the pump. We're gonna turn the pump on.
Okay.
And the dose in the MAR was 125 mLs per hour, so we're gonna set
Okay.
that. We have a new patient, med surge.
Mm-hmm.
We're gonna confirm the patient's identity,
Okay.
select this channel, and a basic infusion at a rate of 125
Okay.
mLs. And it's for 1,000 mLs is the total infusion volume. So we're gonna do 9. Oh, it has, right. It has 4 spots. 1, 0, 0, 0. So there we go.
Okay.
So now we're gonna get an alcohol prep,
Okay.
and let me see your site. Your IV site, ma'am. There we go. So first we're gonna make sure that it's patent.
Okay.
So we're gonna clean off the hub, scrub the hub,
Mm-hmm.
and we're going to all right, ma'am, do you feel any discomfort?
Nope.
Okay, and there's no redness or swelling around the site.
Okay.
And so now we're gonna take the sterile cap off this
Mm-hmm.
and put it onto here and hit, we're gonna unplug this thing.
Okay.
And hit start. So now it'll start.
Mm-hmm.
All right, now we can get the gentamicin going.
Okay.
Weird noise. So I'm just gonna document the time that I'm giving it,
Okay. And is that on the computer?
which is 1500,
Okay.
because the gentamicin is due at 1600,
Mm-hmm.
and you can administer up to an hour before.
Oh, okay. That makes sense.
So right now it's 1500. By the time we get the gentamicin, there'll be about 45 minutes
Mhm.
before. So.
Oh, so that's how you document this stuff.
I'm just documenting that there was no redness or swelling at the IV site.
Okay.
And that flushed easily, and I've also documented the site of the IV and the gauge of the needle.
Okay.
So we're going to save that and move on to the gentamicin. All right, ma'am, I'm going to check your bracelet one more time, even though I've checked your identity about 5 times so far.
Sure.
Let's go ahead and verify your name and birth date again for me.
Marty Yarn, 80 years old.
All right, that's what the computer says. I scanned your bracelet to check it in the MAR. Now I'm going to check the gentamicin. Again, it's 80 milligrams and 100 infused over an hour, and that's what I have here. I'm going to scan it and check the expiration date as well, and so we'll see if there's any floaties
Oh,
or
and it's green, so
debris.
green's good, right?
Green is good. So administration time is 15. Right. Well, we didn't administer yet, so I'll hold off on that. So now we're going to set up our piggyback tubing.
Okay.
And once again, we want everything to stay sterile.
Mm-hmm.
We're going to make sure this is clamped,
Okay.
and then fill up our chamber about halfway, and then we're going to prime it, but we're going to prime it really carefully because we don't want to lose any of the medication.
Oh, that makes sense, because there's not much in there.
Right. So, all right, it's all
Okay.
primed. There's no air bubbles.
Yeah, I see that.
Good. So now we're going to hang this at a higher level than the normal saline,
Okay.
and we're going to connect it above the pump. It's right here.
Okay.
And we're going to use an alcohol prep pad again to make sure that everything that goes into the patient is sterile. We don't introduce any more infections. All right, so now we're going to clamp this down for just a second, pause it.
Okay.
So now we don't want the medication to infuse at 125, we want the medication to infuse at 100.
Okay.
Because that's what the order says. So we're going to change, we're going to go secondary,
Okay.
and we're going to go to G. We're going to click gentamicin. And we're going to put drug amount is 80 milligrams. The diluted amount is 100. mLs. And the patient weighs 175 pounds, which is about 50, 80 kilos. We'll go with 80. Let me just look real quick how many kilos she is.
Okay.
The dose is not going to change, but
Mm-hmm.
just want to be accurate. Why is this in pounds? Who does pounds?
Sure.
Calculator. Clear that. Thank you for letting me use your calculator. So 175 divided by 2.2. So yeah, she was 80 kilos. I should have just went
Okay.
with my instincts.
You have
Okay.
good instincts.
Next, dose is below guardrail limits of 3 milligram per kilo. But we're going to proceed anyway because that's what the doctor ordered.
Yep.
100 mLs per hour for 1 hour.
Okay.
And now we're going to unclamp and start.
Okay.
And make sure that we see the 5 drips in the chamber. And it is indeed dripping.
Yeah.
All
okay,
right.
I see.
And now we're going to label the tubing.
Mm-hmm.
Well, no, wait. First, let's do the MAR.
Okay.
So right now it's 15:10. We're going to write that in our administration time. And oops, I want the R capitalized too. Okay, so
Okay.
documented that.
Mm-hmm.
And so now we're going to label our lines.
Okay.
So today is the 21st. At 1500. So we'll put this on the gentamicin line,
Mm-hmm.
the date and time,
Okay.
and what it was in this tubing,
Mm-hmm.
because certain things won't be able to be administered via the same tubing.
Oh,
But we'll
that
save
makes
the tubing for a
sense.
few days. And then label the other tubing as well. Also, you want to include your initials when you label the tubing.
Okay.
That's on there too. That way, if I did something wrong, they can trace it back to me. Yay! Okay. All right, Mrs. Yarn. Do you have any questions?
No, ma'am.
All right, well, make sure I'm going to give you some information. about your medication, and I want you to press your call light if you start feeling short of breath or a little wheezy, or if you have any redness or rash or hives on your skin.
Sure.
Also, if you start to experience some hearing loss or dizziness or vertigo, let me know as well, okay?
Yes, ma'am.
And here's some more information on your gentamicin.
Thank you so much.
All right, so we're gonna do hand hygiene again.
Mm-hmm.
All right. Give Miss Yarn some privacy. Okay. Alrighty, so do you have any questions?
I do. Were there any pertinent pieces of information you reviewed before administering the client the medication?
There were. I reviewed the order so that I pulled the right dose from the Pyxis. I reviewed that it was the right patient, the right medication, the right dose, the right route, the right time, and I documented the right documentation. Also, I checked the BUN, the creatinine, the AST, the ALT, specific urine gravity, the allergies in case the patient was allergic. Obviously, we would not have given it. Yeah.
Okay. Did this information affect your decision to administer the medication?
Yes. Well, it made me administer the medication, but if certain values were different, I would have consulted the doctor first.
Okay. Did it affect how you administered the
Well, the
medication?
order was not a PO order; it was an IV order.
Okay.
And it was piggyback.
Mm-hmm.
So that's that affected the fact that I gave it IV.
Okay. Those are all of the questions I have today. Thanks for letting me follow you.
Okay, awesome. No problem. Have a good rest of your shift.
Thanks.